Welcome to the lecture on formulating a research question. In this lecture, you will learn ways to identify a research topic, learn what are the differences between a research question, a hypothesis, an aim, and objectives. You will also find out what is a good research question and how to define and refine it using the PICO method. The best research questions often come from the problems you face in your day-to-day clinical practice. For example, you may ask, why are my patients not taking their medications? I have too many patients. What can I do to reduce the workload without compromising patient care? My patients refuse insulin. What shall I do? How is the new healthcare system going to affect me? Is this treatment better than the other? Is there a better way of diagnosing this disease? Is there a better way to communicate with my patients? Does this special diet help to reduce weight for my obese patients? From the previous slide, you may probably have realized that research question can be divided into several categories. Here's an example of how we can generate research questions based on patients, healthcare professionals, health services, and disease. This is adapted from a research framework proposed by Larry Green. Let me elaborate how you can do that. Let's take the example of the bird influenza H1N1 epidemic that occurred in Asia a few years ago. You can ask a research question to find out what the patient or general public know and think about the infection. For example, you can ask, what is the knowledge of and attitude towards H1N1 influenza infection among healthy pregnant women attending primary care clinics? Similarly, using the same topic on H1N1 infection, we can generate a research question to find out what actions the primary care doctors are taking to prevent the transmission of the infection. Then, the research question would be, what are the preventive measures taken by primary care physicians in reducing the risk of H1N1 influenza infection in their practices? You can also think of questions that would address issues pertaining to health services and system. For instance, you can ask how to improve the referral of patients with suspected H1N1 influenza infection by asking, does the use of a standardized protocol in primary care improve appropriate referral to accident and emergency department for suspected H1N1 influenza infection? Finally, you can also find out more about the H1N1 infection by looking at the natural progression, etiology, diagnosis, investigation, treatment, and prognosis. An example would be, what are the prognostic indicators of severe H1N1 influenza infection among patients attending primary care clinics? Once you have found a research topic, it is now important to develop the research question. Many researchers are confused about terminologies used to describe the purpose of the research. What is the difference between a research question, hypothesis, aim, and objective? They're all trying to describe the purpose of the study, but have slightly different meanings. Let me elaborate. A research question should start with a what, how, why, who, when, or where, and asked in the form of a question. An example would be, what is the effectiveness of Tamiflu in reducing complications of H1N1 influenza infection among children less than 5 years of age? In a hypothesis, you are trying to postulate an outcome based on an assumption. You are testing whether your prediction is correct or not. Sometimes the hypothesis is phrased in a way to prove that there is no difference between the intervention and the control group. For instance, Tamiflu does not reduce complications of H1N1 influenza infection among children less than 5 years of age. This is what we call a null hypothesis. If Tamiflu is proven to be effective, the null hypothesis is then rejected. The aim of a study, on the other hand, is to provide an overview of what the study is trying to achieve without going into details. For instance, When we try to find out the effectiveness of Tamiflu for H1N1 influenza infection, we aim to determine the effectiveness of Tamiflu in reducing the complications of H1N1 influenza infection among children below the age of 5 years. Objectives are trying to operationalize the aims of the study. That is, we must define the concepts in the aim clearly so that they can be measured. For instance, the concept complications of H1N1 influenza infection is rather vague and could mean many things such as pneumonia, meningitis, sepsis, etc. The researcher must state the specific complications so that the outcome can be measured. In this case, the complication is pneumonia. Let us now look at what makes a good research question. A good research question is simply one that is answerable, achievable, important, and interesting. I'll go through each of these components. Firstly, a good research question must be answerable. The researcher should be able to define the concepts in the research question so that they can be measured. It should have a hypothesis that is testable, or in the case of a qualitative study, the question should be explorable. For example, is H1N1 influenza infection a punishment from God? The concepts of punishment and God are difficult to define and measure. Hence, this research question becomes difficult to answer. The next characteristics of a good research question is whether it is achievable. That is, whether it can be done by the researcher or her team within the time span and setting. This is particularly important for early career researchers who may not have the research experience and resources to carry out big projects. Things to consider before embarking on a research project include time, expertise, equipment and facilities, funding, ethical issues. It may be advisable for novice researchers to work with a team of experienced researchers for the first few research projects so that they can be guided through the research process. The researcher must keep in mind the feasibility of conducting the study. It is always advisable to conduct a small pilot study before embarking on a full study. In Module 5, we will tell you more about how to conduct a pilot study. Before embarking on a research project, it is important to ask ourselves, why are we doing the research? This brings us to the next feature of a good research question. How important is the research question? To answer this question, the researcher must be aware of the current issue surrounding the research topic. This can be done by reading the literature and talking to experts in the field. You can start by asking yourself, by conducting this research, does it help your patients? Does it help you to help your patients? Does it make a difference to your clinical practice? Is this a common but neglected topic in your clinical practice or literature? Has it already been answered? However, we must bear in mind that a good research question does not mean that you must be doing an earth-shattering study. Most often, it is one that fills a gap in the existing literature, even if it is a small one. Another important thing to remember is that you can repeat a study that has been conducted previously or in another setting, especially when the research findings might have changed over time or under a different setting. Finally, a good research question should be one that is interesting and makes you and your colleagues excited to find out the answer. You can ask yourself the following questions to find out whether the research question is interesting. Does the topic make you feel excited? Does it make others feel excited? Has it been a hot topic in the literature? Is it likely to be a hot topic in the literature in the future? Before finalizing the research question, it is worthwhile spending time to brainstorm how to make the research question more interesting and relevant. For example, if you are trying to do a study on what is the practice of management of H1N1 influenza infection in District X, it might be more interesting to do a study comparing the practices between two districts And if there's a variation, what are the reasons for the practice variation? You may instead ask the question, what is the practice variation in the management of H1N1 influenza infection across District X and why? Now that we have described what a good research question is, and assuming that you have decided on a research topic, the next step is to define the research question clearly so that it can be answered. Let me introduce you to the concept of PICO, or in short, PICO. This is a concept that I have borrowed from the evidence-based medicine discipline. Let me explain what PICO stands for. P refers to a specific group of population, people, patients, or place. This is the who and where. I refers to intervention. This is relevant if you are conducting an intervention study, and the type of intervention should be included in the research question. This informs the reader what the intervention is and how it is done. C refers to control, which is relevant in a controlled study where the intervention group is compared to the control group. Finally, O refers to outcome, which is what the study is trying to measure. Let me give you an example in the next slide. Each research question should contain at least two components, that is, P and O. If the study involves evaluation of an intervention using randomized controlled trial, then all four components of PICO should be included in the research question. Let me illustrate with an example how you can use the PICO method to help you define and refine your research question. Let's take how do doctors manage H1N1 influenza infection as an example. Looking at the research question, it would seem like a straightforward research topic trying to find out how doctors manage the infection. However, this research question is difficult to answer for several reasons. For example, who are the doctors? Where are they practicing? Hospital or general practice? And what do we mean by management? Fortunately, PICO can help us to refine the research question to make it answerable. Let's start with P. Who are the doctors involved in the management? Are they general practitioners in primary care, specialists in hospitals, or intensivists in the intensive care unit in the hospital? This must be clearly defined. It is also important to describe the doctor's role and setting. Since this is not an intervention study, we do not need to include the I and C. The outcome of this study is the management of H1N1 influenza infection. For this, we need to define what is management and what is H1N1 influenza infection. Management may include diagnosis, treatment, doctor-patient communication, or follow-up plan or admission. It is also important to specify the timing of the management, whether it is at the beginning of the epidemic or towards the end, as access to information or guidelines for the management of H1N1 influenza infection may change over time. As for definition of H1N1 influenza infection, it is important to determine which target group the researcher is focusing on. Patients of all age groups, children, pregnant women, elderly. Similarly, the stage of H1N1 influenza infection should be clarified, whether it is referring to suspected or confirmed cases, as the management are different. After refining the research question based on the P and O of the PICO concept, the final research question may look something like this. How do general practitioners diagnose and treat children with suspected H1N1 influenza infection in District X? Now you have learned about how to ask a good research question. There are several more tips that I would like to share with you. Firstly, before finalizing the research question, it is crucial that the researcher reads the most current literature on the subject matter. This is to avoid duplicating the same study or helping this researcher to prioritize the research area. Secondly, be open to new ideas. Avoid fixing the research question too early. Talk to your colleagues, especially the content experts, and ask for their views and thoughts. It is also important not to let the research methodology restrict your research question. Avoid deciding whether you are going to do a quantitative or qualitative study first. Always think of the research question, then decide which methodology is the most appropriate and feasible to use to answer your research question, not the other way around. Some of us may be ambitious and try to answer a few research questions in a study. Do this only if you have the time, expertise, and resources. Otherwise, I would suggest starting off with asking a focused research question. Once you have found the answer, you can then build on it by answering the next question. Finally, you must be ready to be challenged by others on your research question and be prepared to change or defend your research question. I would like to end this lecture by restating that it is crucial to define and refine the research question until you're happy that it is answerable, achievable, important, and interesting. This is an iterative process. Thank you.